Hello everyone, welcome to AKS main Shikshana program. This is Santosh Koka. Today's question for 3rd July 2024 that is related to subject social justice. Discuss the challenges and prospects of implementing the universal healthcare in India. So this question taken from regarding UPSC, but also it covers related to APPSC and also TSPSC, right? APPSC and TSPSC, we have social issues and society topics, right? So we can cover all those topics. Then first we need to take certain steps, 3 steps before writing a good answer. That is, first, question reading. We need to read the question twice. In this question reading, we need to focus on how many important parts are there in the question. Here only one part is there, and also what is the important topic here? That is, topic is universal healthcare in India. So what is the question tags? How many question tags are there? Only one. Discuss. And also important key words. What are the important keywords? Challenges and prospects, right? So we need to focus on all these aspects before writing an answer. That is within 1 minute. Next, we need to focus on what are the next step? Brainstorming. Brainstorming means we need to recollect all the important information related to the question. What are the important information related to universal healthcare in India? We need to include different examples, and also we need to include different definitions based on United Nations organizations or something, and also we need to include certain significance part related to facts and data, and also reports and indices, right? And also, what is the third step? We need to present the answer. We can use some flow charts or diagrams or important facts related to particular universal healthcare in India, right? So now we can see how can we write introduction for this question. We can write introduction at least in 2 to 3 lines, right? We need to write introduction. We need to complete within 2 to 3 lines. Here we can briefly define universal healthcare and its significance in the context of social justice in India, right? Simply we can relate to either recent reports or, for example, recently we have certain examples related to particular universal healthcare, right? Without financial hardship, we can aim to ensure that all individuals have to access necessary health services. That is the main definition of universal healthcare. It is a cornerstone of social justice, promoting equity and well-being, right? We need to write simply in an introduction manner. Next, body part. Coming to body part, here we need to mention first significance, right? The question tag is discuss, right? Whenever the question asked regarding discuss question tag, we need to first write the significance part, right? We need to mention here, we can mention some important or highlight the importance of universal healthcare in promoting equality, reducing poverty and improving public health. That is the main importance here, right? We can include within examples, some sort of examples also we can include. For example, recently we have National Health Profile 2023. According to National Health Profile 2023, nearly 70% of healthcare expenditure in India out of pocket, pushing many families into poverty. That is the main report recently released, right? Universal healthcare can mitigate these financial burdens and promoting inclusive growth. That is the connective point we can write here. So next we need to write some challenges, right? Challenges means negative, significance means positive. Whenever the question asked with discuss tag, question tag, we need to mention positives, negatives, and also needed measures, right? what are the important challenges here? We need to discuss the key obstacles in implementing universal healthcare in India. Universal healthcare in India. What are the important obstacles we are facing in India, such as financial constraints, or infrastructure issues, workforce shortages, or governance challenges, right? We need to include all the important challenges. Then we need to measure, or in the question tag, one more important keyword is there apart from challenges, that is prospects, right? We need to mention the prospects. Prospects means almost this is also a positive keyword, right? Here we need to outline the potential benefits and opportunities of successfully implementing universal healthcare. Whatever universal healthcare prospects are there, we need to mention here, referring recent examples and data. What are the important data or recent examples here? We need to mention according to WHO, World Health Organization recommendations. For example, it recommends doctor-patient ratio around 1:1,000, right? That is the important here. But in India, it has a 1:1456. That is 1456 members patients. One doctor is only available, right? So that is the important case. We need to mention like these type of examples in between. Then only we can our answer will be benefited, gaining 1 or half mark again, right? So next we need to focus on different needed measures. What are the important needed measures here? We need to suggest solutions and strategies to overcome the challenges, whatever challenges we are facing in the first part. So please check here. Whenever discuss keyword is there, we are writing first positives, negatives, and needed measures. But here in the question tag or question, they have mentioned first challenges, right? Then prospects. We need to follow the question structure or question pattern on whatever the question is asking about to write. We need to follow the same structure. Okay, don't be confused or don't confuse the exam. Okay, then here we need to suggest some solutions regarding the challenges. Here we have increasing fund. Government need to increase the fund, right? Needed measures. Government need to increase the measures, increase the funding. Funding problem is there, right? Almost at least 5% GDP can provide the necessary sources, right? Measures also need to include here. So what are the important funding? We need to include the funding. Next important is infrastructure development. Already we have important challenges facing regarding infrastructure issues. So we need to invest in healthcare infrastructure, especially in underserved areas. Is critical. Next, strengthening workforce. Workforce means already we have taken some example or report according to WHO, right? Doctor-patients ratio. So here we need to focus on strengthening workforce or increasing workforce. Next point, we need to mention efficient governance, also one of the important needed measure, because we need to streamline policies and enhancing coordination between central and state governments. That is the important case here. So we need to improve the implementation of universal healthcare or public health services, right? So finally, we can conclude with a simple note here. Already we have mentioned so many, means at least 3 to 4 challenges or suggestions we need to mention. Apart from that, we need to conclude with a simple note. The successful implementation of universal healthcare in India requires a multifaceted approach addressing whatever we have issues, financial and also infrastructure issues are there, and also we have governance issues, right? Governance challenges. So with continued investment, policy, innovation and commitment to equity, India can move towards a future where healthcare is accessible and affordable for all, ensuring a healthier and more equitable or just society, right? we can write like this statements here. So apart from focusing the challenges part, okay, then this is the best approach to write this answer, because here one important rarely asked by UPSC question tag, what is that? Discuss is there. We need to be careful here. So now we will look into one important recently written answer by Pramila. So first, we have to see the introduction. The United Nations defines UHC as everywhere should have access to the health services they need without risk of financial hardship. This is what we needed in the introduction part. So according to some United Nations or any WHO or any some institutions, we need to connect. Okay. So what are the important challenges? The particular question, they have asked challenges and prospects as a keywords. So funding constraints, we have funding constraints. For that we need to expenditure. What is the expenditure? Only 2% is there. So example also written during COVID-19 also we have faced insufficient funds, right? Next, infrastructure deficit. We have rural region faces severe shortage. So here second wave of COVID also exposed this particular healthcare infrastructure lack. So quality and accessibility disparities in services access regions lead to unequal access. Like states like Kerala fare better due to established healthcare systems, unlike many northeastern states. That is also very important point here. So next, administrative hurdles. Here, governance challenges, bureaucratic inefficiencies, or corruption impede implementation process. Right? If you take any scheme, this is the main common point regarding governance challenge, administrative hurdle, right? Implementation problem. Next, we need to focus on what are the important examples here related to administrative hurdles. Delay in the distribution of COVID-19 relief. Already we have faced so many issues in the COVID-19 period. So prospects, what are the important prospects? Means here positives. Improved healthcare outcomes, successful implementation of the COVID-19 vaccination drive, that is good sign. So economic benefits, healthier population boosts productivity and produces financial burdens. So for example, Ayushman Bharat's insurance coverage has significantly reduced out-of-pocket expenses for many families. So finally, third point, social equity. We have initiatives like PM Jai, means Pradhan Mantri Jan Arogya Yojana, right? Started to address healthcare access disparities, right? Very, very important here. And also, we have another point, technological integration, right? So telemedicine and digital healthcare systems can bridge divides. The Ayushman Bharat digital mission aims to create a unified health and digital health ecosystem. Very, very important and good points here. Each and every point she has written examples, she has included examples. Very perfect. So finally, in the conclusion, effective policy design, increased funding and robust implementation strategies are crucial for overcoming challenges, and realizing these prospects can pave the way for achieving universal healthcare in India. Very, very good conclusion. But here we need to address, before starting challenges, at least 2 to 3 lines we need to focus on significance part. Okay, significance. What is the important role played by universal healthcare? We need to give a significance or importance sentence, 2 sentences related to universal healthcare. That was missed in this answer. And also a number of examples were written. Apart from that, you need to include some reports. Already we have seen, according to WHO, doctor-patient ratio or patient bed ratio, right? All these are important. Okay. Apart from that, we need to include some challenges, removing challenges. We need to tell some needed measures before concluding. Okay, we need to include needed measures separately, because the question tag is discuss. Discuss means we need to write positives, negatives, and also needed touches. Very, very good. Apart from that, all the important missing points written well. So for this question, we can give simply according to the recent examples and each and every point included with example, right? Here we can give out of for 10 marks, 4.5 we can give, right? Very, very good. So improving a lot every day. So because all are writing in a discussed manner. So but every student or aspirant is trying to write the answers and sending. But here we need to focus on the concept, and also we need to improve our daily basis. Means we need to include some certain rules and regulations related to writing answer and uploading. Apart from that, we need to focus on introduction, body part, and conclusion within a proper structure. And also we need to include the presenting part. Apart from that, we need to include important flow charts and also diagrams or maps or graphs, right? So, okay, good. Tomorrow's question for mains section, our question for 4th July 2024, that is day 6, discuss the impact of the goods and services tax on India's economic growth. Here, question tag is again discuss. Be careful, very, very prominent or mostly used by UPSC and APPSC, TSPSC. That is subject related to economy. Write your answers and upload in the app. Thank you very much. All the very best.